Thank you, Speaker. I also wish to make a brief contribution and speak in favour of the Health Services Amendment PPP Prohibition Bill 2025. At the outset, I fundamentally believe that government health services should always remain in public hands to ensure universal access to health care, equitable care, affordability, accountability and responsiveness to community needs. Public managed healthcare services are less likely to prioritise profit over public wellbeing, offering accessible and quality services for all, regardless of the size of your wallet. Here's why maintaining public control over these services is crucial. Equity and social justice. Public services aim to provide essential needs to everyone, regardless of their ability to pay. This ensures that vulnerable populations and those who might be marginalised are not left behind. Accountability and transparency. Publicly managed services are subject to public scrutiny and scrutiny by elected officials, such as members of Parliament. This accountability helps ensure that resources are used efficiently and effectively, and that those services are delivered in an open and transparent manner. Long-term planning and investment. Public entities can plan for the long-term needs of a community without the pressure of short-term profit targets. This allows for investments in critical infrastructure and services that benefit generations to come. Responsiveness to the public's needs. Public services are designed to respond to the needs of those communities that they serve. Citizen feedback and participation in decision-making processes help ensure that services are tailored to the specific needs of that local population. Preventing market failures. And I think this is a very poignant one given the bill that we're dealing with here. Certain services like healthcare, education are essential for functioning society, but may not be profitable for private companies. Public provision ensures that these services are available to all. There really is a social justice principle here. The Health Services Amendment PPP Prohibition Bill 2025 will achieve this by preventing governments from entering into a Northern Beaches style arrangement to build or operate an acute public hospital. The bill is only intended to prevent PPPs where a private operator builds and operates the hospital and provides all the acute clinical services to public patients. Such arrangements have raised complexity in terms of oversight of the provision of clinical services at the hospital and handover of the hospital at the end of the PPP contract. And it is like trying to unscramble an egg or unravel a bowl of spaghetti when you're trying to navigate through these convoluted contracts that have been entered into previously. Under this bill, other types of PPPs will still be able to occur, such as using private persons to provide facility management services at a hospital. Similarly, the bill will not prevent the provision of some clinical services being provided by a private person to public patients, such as radiotherapy, medical imaging and pharmacy. These are all very, very beneficial, or not just beneficial, critical services which also need to be provided hand in hand with our public hospitals. The bill does allow regulations to be made to exclude certain types of agreements from the prohibition. A regulation-making power has been included to safeguard against any unintended consequences in the bill, as there are types of arrangements with private persons that are used appropriately within New South Wales Health for the benefits of patients. For example, and I know one of the previous members who spoke from our side also pointed out the Chris O'Brien Lifehouse for Cancer Services. those arrangements with private hospitals to address the backlog of elective surgery that we're still working through post-COVID. The bill is a further aspect of the government's response to ongoing concerns raised about quality and safety at the Northern Beaches Hospital. It specifically responds to the request from the parents of Joe Massa. That request to government was to legislate to prevent any future Northern Beaches hospital-style public-private partnerships from happening into the future. So what has the Labor government been doing to complement this bill as well? In addition, we've also established a parliamentary inquiry into the Northern Beaches Hospital through the Public Accounts Committee. We've initiated an independent inquiry into the Emergency Department of Northern Beaches Hospital. We've arranged a roundtable to improve the REACH protocol scheduled for late April. We've requested a coronial inquest into the death of Joe Massa, and my heart goes out to his parents, family and friends. I can't even contemplate what it must be like to lose someone at such a young age, which it remains to be seen exactly what the outcome of such a coronial inquest would throw up, but I'm sure it's not going to be good. We are committed to ensuring that Northern Beaches Hospital implements all the recommendations of the serious and adverse event review into little Joe's death. And after the fiasco, can I say, Speaker, of the Port Macquarie Hospital privatisation, and after hearing the Minister during question time, I of course was not in this place at the time that it was privatised. It seems not just once, but twice. And that fiasco and the government having to buy it back, not just once, but twice, at a huge public cost. And that cost is a cost that could be going to providing other services within the healthcare system without having to unravel those thought bubbles from the Liberal Coalition Party, who believe that privatising our healthcare is a profitable way to enrich the government's coffers on the day. It just ends up costing us over and over and over. And we heard in the PID on privatisation just in the last couple of days exactly what that cost is to government. Can I just say that my local hospital is Nepean Hospital. It's run by the local Nepean Blue Mountains Health District Board. They do a fabulous job. I acknowledge it's chaired by Peter Collins, who was a Liberal member in this place. He has our community at heart. He lives in our community. He really is doing quite a good job. So I'm all about giving credit where credit is due. This debacle should never, ever be repeated again. And this government is stepping up to ensure that it doesn't. And it's for that reason that I commend the bill to the House.